Today at Hennepin Airway, we're going to go on a tour through our Airway bag that emergency faculty bring to inpatient medical emergencies, or code blues, here at our hospital. We've been the primary responders to these emergencies for the last couple of years, took over that role from the anesthesia department to let them focus on their operating room practice and same-day surgery center. We'll have a separate video up on the channel to talk about what we do at a response and some of our outcomes. But now we'd like to take a minute and take you through the Airway bag.
So to give you guys a quick Airway tour of the adult bag, we also respond to pediatric Airway emergencies. That's going to be in a separate video. So this is the adult bag, and the bag itself is actually done by Chinook Medical, and it is the medical operator pack. We'll have a link with that in the description below. We found it was a really good bag. It's slim, but it holds a lot of equipment, and it is a backpack style bag that we are able to get to places really easily. We also like it because it's modular and compartmentalized. So clear labels on the outside, and then because we've got 2 intubation systems inside, we had to attach some of these external pouches to have equipment readily available as well as easily identifiable. So for a bag valve mask, that is on the outside, and this is where our adjuncts are kept. So OPAs and NPAs are all in here, and then we use something called a pocket BVM. This is made by Cyclone, and it's available at multiple different vendors, but this is a full adult bag valve mask that actually is compact and in this little tube system and allows you to store it really tightly and fit in this external pocket. We've got Airway carts throughout the hospital as well, and our code carts that are equipped with the normal ambu bags as well. But we wanted this just in case there's somewhere in a more austere environment, like in a bathroom or something, not near a code cart on a patient ward. We also have surgical chests on the outside in case we encounter a pneumothorax under tension physiology that we need to relieve. So there are a couple spear needle decompressions in here, as well as equipment for an open finger thoracostomy. This is our surgical airway kit. In here is a scalpel, a 6.0 endotracheal tube, a bougie, a tracheal hook, some ChloraPrep, as well as a syringe for the cuff on the endotracheal tube. We use a very simple method of the surgical hook, and we'll link to that for literature in the description below as well. So opening up the bag, the nice thing about this bag is it is fully modular, so when you open it up, everything is compartmentalized and ready to go. So for just a straight intubation, we've got our CMAC intubation, and we prefer the CMAC in most of our intubations, so this is what we go for. In this compartment is everything you should need to perform tracheal intubation on an adult patient. So we've got our CMAC pocket monitor on a MAC 4 blade ready to go. Set it over here. We've got a couple different blade variations. There are MAC 3s in here for people that might prefer that. And then we've got a loaded endotracheal tube, 7.5, preloaded with a syringe and some lube that's also ready to go. There's also a suction canister, because the large bore suction canisters are what we use in our stabilization room, and they are bigger than the ones on the inpatient ward on the floor. Small point, but biohazard bag for returning the blade to central processing. And then we've also got 6.0 endotracheal tube in here. When we first built these bags, we had a lot of discussion what the tube sizes to build. 7.5 is the standard that we use for most adult patients. And we wanted to balance having equipment available versus overloading and carrying too much stuff. So we've got a 7.5 and a 6.0. Thought being that if there's some severe stenosis or something where I cannot intubate with a 7.5, my next logical step is going to be a big step down, probably to a 6.0 tube. And you don't need to go and have every single half step available. Endotracheal tubes are available in all of the Airway carts as well, in the code cart. So if we really need like a 7.0 or 6.5, they're available. They just aren't readily available like in this bag.
And I should add, as we designed these bags, we've decided to use reusable stores equipment as our primary video laryngoscope. The benefit there, I think, is these metal blades feel good for the operator. They're the right weight. And with a pocket monitor that has good battery life and excellent visualization, it seems like a really solid primary system for us to use instead of investing in disposable blades that we could throw away at the bedside.
Yep. And these are a little bit more expensive, but they last, and I think they're worth it. But whatever video laryngoscope folks use is reasonable. The other thing we wanted is to be able to have end-tidal CO2 confirmation for our tubes. We've got side stream capnography in all of our ICUs and our emergency departments for intubation, but not on the floors, obviously. So we have this EMA capnograph. It's actually made by Massimo, and it is a really nice little capno that you can place in the side stream, and it turns on, and it gives you pretty instant end-tidal CO2 with a waveform. So if I it'll actually give you a waveform readout here on the screen that allows you to get instant end-tidal, and this part is disposable. So we've had a lot of great success with this piece of equipment. The bougies, because we don't want them stored in a coiled up fashion, because doing that makes it more difficult to straighten it out, are stored along the outside of the bag in these hooks for the operator to have instant access to a non-bent bougie. Foreign body removal, we've got a McGill forceps here available in case it is a choking type situation, and that's tucked in the side over here. For folks that want to use the glide scope with a pocket monitor, we've also got the glide scope Go 2, which is another pocket monitor that comes both with size Mac 4 blades as well as the traditional glide scope hyperangulated blades, the S3 and the S4 blade. Those are available in here, as well as the glide scope stylet. I would say we use these a little less frequently. We're more of a CMAC heavy group, but these are available as well for folks that do prefer them.
And I think one of the great things about this bag is the redundancy built in. So you have a couple of portable video laryngoscope systems. You've got backup airways that we'll go into next. And then the other thing that's very valuable is to have all of our emergency RSI and medical emergency medications stored in this bag. So these can be stored at room temperature. We have pharmacy support in our department to make sure we're following expiration dates and replacing these when we need to. But just to highlight what we've got for rapid sequence intubation, we rely heavily on etomidate. Here are two 40 milligram vials of etomidate, and then the paralytic, which is called out by these bright pink tags identifying as a paralytic, are rocuronium bottles. So etomidate and rocuronium is what we keep. They're not controlled substances and need to be stored under lock and key, so we can keep them in our airway bag. And then we also have a vial of vasopressin, 20 units. That's very helpful for peri-intubation hypotension as a push dose vasopressor. And lastly, we carry vials of naloxone. Should also highlight that our security officers at the hospital also carry intranasal naloxone, so we have multiple ways to rescue accidental opioid overdose.
I think when we first started, people asked why not succinylcholine. Sucks only lasts a couple of weeks out of the refrigerator, so we were seeing a large amount of waste and going through a lot of sucks. So we removed that from the vial, and then there's no ketamine available because it's a controlled med and needs to be in the locked Omnicell. These are in our locked stabilization room, but all the faculty have immediate access with our badges, but no controlled substances in here. So moving on, we've got a label here on there. This is syringes, needles, and flushes. Again, the nurses are very good and have immediate access to this, but if you're in an odd location that does not have that, there are a bunch of syringes and needles in here for drawing up your induction medications. And last but certainly not least is our supraglottic airways for our backup. We have 3 different supraglottics available in our airway card in the stabilization room. And I think it's really important to have 2 different classes of supraglottic airways. So for us, we've got both the King airway, and we've got size 3, 4, and 5 of those. And then the intubating LMA or the ILMA by Teleflex, we've got multiple sizes of those as well. Just because I think it's important to have 2 different airways. I have had the ILMA fail and the King works really well. I've had vice versa. There are just different patients, different physiology, different anatomy, that having 2 different classes of airways I think is really important. We've also got the ILMA stylet in here for removing it after intubation. So that's the outside of the bag. A couple more important features to mention is it is modular. It's in a backpack design, so it's really easy to carry and it's really light. I mean, it's probably about 15 pounds. So folks can carry it, and then we can throw it over your back and put both shoulders through. It's actually really easy to carry. We've got 2 available in the department at all times. So if we get called to one medical emergency, and a second one gets called, we do have a backup set, and we've got a system in place for that. For restocking responsibilities, we've got an agreement with pharmacy that check the expiration date on the RSI induction meds, and they will restock them out of the Omnicell. Otherwise, we are responsible as faculty for restocking the equipment and making sure that everything is set. We've red tagged the more rare things like Crike kit and surgical chest that have all the equipment in it. But other than that, if you're on the shift that responds to inpatient medical emergencies, part of your job duty is to check this bag and make sure the battery on the portable laryngoscopes are charged and the tubes are in the right spot and you've got enough supraglottics and you've got those other things. And it's just something we've built into our practice that we check at the beginning of every shift. Hey everybody. In addition to managing inpatient airways, if your department doesn't do this routinely, there's also other areas we found these bags incredibly useful. In the pre-hospital environment, we take these bags anywhere we're going to do an advanced airway. In the other areas of the emergency department, if a critical patient decompensates in the CT scanner, we've used these bags in there to establish a airway before bringing them back to the stabilization room. As well as during mass casualty events, when the number of critical patients overwhelms the stabilization room's capacity, we've had to bring sick trauma patients out to a regular ED room, and we've used these code bags as an adjunct for airway management in a pinch when we need to.